Hi, Nishi.
Good morning.
Good morning. So nice to have you here on the podcast.
Oh, you're welcome. You're welcome. Nice to be here. And
Yeah,
it's been a while since we've been chatting.
yeah, it's been a little while. So, before we get into it, I'd love for you to tell the audience a little bit about yourself, what you think is important, and then we'll start our conversation.
Sure. So Natalie, as you know, I'm a physician. I've been in medicine for more than 30 years and a family practice training. And about 23 years ago, I left my general practice and just started to do women's health, particularly midlife women, menopause, and hormonal medicine. And so that took me on a beautiful journey of really being able to learn a lot myself about women's journeys, but also to empower a lot of women in their own journey on their path for health and answers. And, 25 years ago, the landscape of menopausal medicine was very different, and not many people were talking about it. A lot of women were falling through the cracks. And so, in order to really meet the needs of the women around me, I left the general practice and just focused solely on that area. And it's been so rewarding professionally. I've learned so much, but I've also been able to help so many people, and I'm just excited to continue learning and evolving. And I think um, that's where coaching led me, because with my practice, I've always had an integrative menopause practice. So not just looking at the symptoms and not just looking at medication, but looking at the whole picture and trying to integrate a woman's lifestyle, emotional, physical needs, and getting the bigger picture. And in that, what the role is really to empower women to be in the driver's seat of their own health, and give them guidance. And so in that journey, coaching just fits naturally, because it's really about putting women back into the driver's seat and looking at their own health. And I think that, I was informally doing a lot of that. But when I started to explore coaching, I just found it so powerful and took me to the next level. So yeah, I'm just
Mm.
excited about it.
Wow, it sounds like a really interesting shift. And I guess, I'm at that age, I'm 50 now. So I'm kind of thinking maybe it's that I'm at that age and it's in the front and center for my life. But I can't help but hear so many women talk about, menopause, and also coaches wanting to specialize in that area. And so I'm curious to know about, what led you to want to specialize in that area and how coaching kind of complements that, what your experience has been in that sense.
Yeah, I mean, certainly, I think for me, I have an undergraduate way back in psychology, so I've always been interested in the mind body piece, and just the psychological piece as well. And so, early on in the first 10 years of my practice, I was seeing a lot of people and different physical and health related concerns. And what at one point, one of my colleagues said, look, we really need someone to do some menopausal work. And I was very young, and I didn't really know a lot about we don't get taught much in medical school back then about menopause and hormonal perimenopause. So, I said, it was piqued my interest. So I said, okay, let me dive in, and I will learn. And I did a lot of learning, and sought out other colleagues who were already starting to be interested in that. And so we partnered together. But eventually I realized that, if I wanted to do this properly, I can't be seeing a person with asthma in 1 minute and then doing, you know, hypertension and other stuff, and then immunizations. He really needed to be present and dedicated. And I realized that women were falling through the cracks. So,
Mm.
and when a menopausal woman comes into the office and, um, starts to talk and not really sharing, but then suddenly is like, is crying or is upset and just, can't, feels like she's not being heard. I can't just say, oh, I've got a next patient. So I had to really think about what did I want to do? And it just hit a real deep chord that a lot of the women at that time, 25 years ago, were falling through the cracks and needed a broader uh, perspective of what's going on with their health, like understanding their journey, or them understanding their journey. And, at that time when that happened, there was a big study that came out that hormones were bad. And so everybody was taken off of hormones, and they were just left to sort of think about, okay, how are you going to manage this, and get on with it, dear. It's a part of life. And that was kind of what a lot of patients were told. So, I knew there were better answers, and myself, and I met another friend of a colleague she was very interested in mind body medicine. I was interested in women's health, and we kind of came together and our worlds collided, and it was just a beautiful journey, around then starting to educate women, um, around what's going on with their bodies, what are the influences of stress, what are the influences of diet, what are the influences of lifestyle, genetic history, what are their treatment options, how is it right for them, choosing the right things for them. Because what we found was there wasn't any dearth of information sometimes in this whole journey. Like people sometimes were bombarded with information, everybody trying to maybe sell something or recommend their perspective. But it's women were confused about back then about how do we make that applicable to us, like to one's person self, right? How is it, how does that affect my journey? What should I do for myself? And a lot of times women would say, oh, well, my mom did this, and or my friends did this. Well, we had to educate women that, not sometimes it's not the same for everybody. And depending on your risk factors, depending on your lifestyle, depending on your stress levels, depending on your own personal beliefs. And I think that's where that was so important, because when women were felt heard, but also felt that they were tailoring the treatment or the approach to what their particular needs and beliefs and biases were, was important, because then they had options to choose. It wasn't one size fits all.
Right. Wow, that sounds like it was very sort of organic in the way that it all happened.
Very organic. We just grew and started to learn a lot about different parts of different parts of medicine, not just mainstream medicine, but integrative medicine, naturopathic medicine. I did a course in Ayurvedic medicine, so I, opened my world. And that's what I was saying. It was just, it was a love affair with medicine again. And it was so broad and open to learn, but also to help women at the same time. So yeah, I've thoroughly enjoyed the journey.
Well, and I appreciate some of the things you said that led you to realize that it was going to be a specialty for you, like having to balance those different needs of health, the time allotment for a patient. I think that's an important consideration when you have emotion involved and you have storytelling and personal, I guess just experiences coming to the table. And I think it sounds like a very personal approach. So I wonder, what did coaching, or what led you to coaching, or how did coaching become a part of your focus?
Well, I mean, again, even in that sort of time approach, I mean, what was really important was the time and understanding, but it was also the education. So we did a lot of educational sessions and helping women to really understand the whole process or what's going on with their own bodies. So I think there was an education piece. There's a a risk assessment piece, so understanding their genetics, their lifestyle. And I think what what I found was in doing all of that, it was very empowering for women, very empowering. And there was also a lot of advice given and consultation given. And you know, we would talk a lot about stress because the huge effect of stress on the hormone pathway. And what I was finding was that was wonderful. You know, like I felt I was be able to really help women. Women felt empowered. But you know, over the last few years, I've been, you know, obviously I've been seeing for 25 years now, seeing patients one-on-one and then doing group educational sessions. But what I found was that, you know, I said, I wanted to actually be able to reach a larger group of people because I said, I have all this experience underneath my belt and I can't see everybody one-on-one. And, you know, I'm 59 and I still have enough in me to be able to help a lot of women and empower a lot of women, but at a different level. And I think for me, what coaching, why I got interested in coaching was kind of two reasons. One is that I'm interested in probably doing some group work and group coaching so that I can help a larger number of women at a time, but also because I recognized in some of the work that I was doing is that the group dynamic is very powerful and very
Mm.
helpful to women. So when we were doing educational sessions, you know, some women would ask questions that another person was afraid to ask, or some women would say, oh, this is my perspective, or this is what I went through, and it would resonate with women. So they were learning not only from me, but they were learning from each other. And that was very, very powerful. So, you know, I thought, that's a beautiful way to put women not only in the driver's seat, but to also have a shared experience. And some experiences may be different, some experiences may be the same, but it's understanding that there's different perspectives and that you're not alone, right? And I think with the group work, so that's why I got interested in coaching. But the second piece was that I recognized that a lot of times I was telling women things like, okay, this is your stress levels, and this is, you know, this is how it's impacting. And I would educate them. And I said, you know, maybe you need to maybe embrace some stress relieving techniques like meditation or exercise or changes in diets, because we know how much lifestyle and all of that impacts hormonal medicine. And they would take the advice, but where sometimes there's a block is this is the advice, and now where are the blocks to make it actually happen, right? What's going to change in their lives? What's going to be able to shift so that they can actually be empowered to take the steps that they need to do for themselves? And for some women, you know, it was enough. I would be able to give them a pathway or a roadmap, and they were motivated and they were able to just run with it. And other women were just stuck, and you know, what's holding them back? Where is it? And when I started to recognize is there's sometimes a lot of emotional reasons that are holding them back, or beliefs about themselves that are holding them back. And it's not that they don't have the knowledge or not that they don't have the willpower, but you know, they would started, but not be able to recognize, where am I going, and why am I not able to go ahead and move forward with what I know is the right thing for me to do? And sometimes they wouldn't even know what the right thing for them is, right? So I might tell them that this is an option, this is an option, this is an option, but you know, they had to really sit with it and understand what is right for them. And we always encourage women that there's no right or wrong answer. It's about understanding what's right for you. And so in that journey, I think that's where I got interested in coaching, is because that's the next piece, right? Like I kind of have gone through this whole journey, but I think that's the last piece to kind of really um, set a woman up for success and go to the next level and beyond. Because
Wow.
I know with coaching, that's what we're doing, right?
Yeah.
We're really being able to explore what's happening for that person.
So it's so compelling what you're saying. I'm thinking about the women in our community and also a lot of inquiries that we get about, becoming a menopause coach. You are a physician with extreme amounts of training in different areas. You said Ayurvedic, you said other avenues of training. What's actually possible for someone who doesn't have that kind of background to become a menopause coach? Like, what would that look like?
Well, I think if you didn't have the medical background and the knowledge, I think with a menopause coach, again, it's just like being a coach then, right? It's
Right.
being, but if you have a particular interest in menopause or that range of women in that age group, is to be able to let them be heard and helping them to discover those roadblocks or what's going on for them. Because like I said, sometimes, especially now, I mean, 25 years ago it was different, but especially now, there's a lot more information out there on menopause.
Mm-hmm.
So there's not as much lack of information, but there's still at some level for many women a resistance to talk about it, to talk about menopause, to talk about what they're going through, because women will feel sometimes very vulnerable because they're not feeling like this. They're not the same person. They'll go through cognitive changes because they can't think clearly anymore because their hormones are running a roller coaster, or their emotional situations are different, and it's a roller coaster. So a lot of women feel embarrassed to talk about it because they don't even recognize sometimes that that's what's happening, especially in the perimenopause. So I think where a menopause coach, a role could be is to really first allow a woman to be able to dialogue and hear herself and have someone to have that active listening to, right? So that she can reflect on what might be happening for her. And then creating a safe space to be able to get the help she needs if she needs help, right? And I think that's the first piece. Like women want to feel heard, and I think the first piece in feeling heard, whether it be your physician or whether it be a healthcare provider, but the first place we have to feel heard is ourselves. We actually have to really able to acknowledge our vulnerabilities and what's actually happening. Because as women, many women, not all, but many women, we're so used to putting up a front to be there for everybody else, right? We're so used to be the caregivers or the people who are, always trying to hold the fort. Especially high functioning women, there's a lot of pressure at work and at home and trying to balance that all, and then still acknowledging to themselves that I can do it and something drastic is not happening. So it's a very tough time for women, and it's starting to be recognized in the workplace that menopause will affect sometimes a work situation, but that we have so much wisdom and knowledge and experience to give that we can't throw the baby out with the bathwater, right? And so there's the workplace is changing. There's a changing dynamic to actually acknowledge that transition, and rather than just women get sidelined sometimes, rather than doing that, embracing that and helping women so that we can actually it's a win-win for everyone. And so I think going back, again, going off on a tangent, but going back to that is that the first place to start is a woman has to really understand what she's feeling, what's going for her. Because sometimes if they're worried about work, they'll say, oh, I'm not sleeping well, or I'm this, but then deep down, when we talk to women, it's like I'm not not able to keep up with work because I'm not sleeping well and I'm forgetting and it's taking me forever to get all my work done. And I'm afraid someone's going to find out, or I'm afraid that I'm going to lose my job. And it's frightening. It's terrifying for women. And so when they are able to discover what's actually going on, what are their fears, we're able to put a label on, we're able to acknowledge it and then find solutions. But the first piece is to really understand themselves.
Oh, I really love what you're saying. And to me, that makes sense because coaches are not meant to be the expert. It's the client who's the expert, right? And
Yeah.
the coach is there to support someone to find the expertise or to be resourceful to find what they need in that situation. And I guess so to me, becoming a menopause coach is about having a really solid framework for coaching that you can coach anyone with any topic that comes, and that person will then seek out the expertise they need after the coaching session.
Yeah.
And also what I'm thinking about as you're talking is lots of ideas are running through my head, but one of the other ones was, is there, you're off at, you mentioned you came back from a trip from, I think you said Kenya, and right before we started our conversation. And I wonder, do you notice a cultural difference between how people relate or adapt to menopause? Is there, have you had that experience in your career where you notice the cultural impact?
Very interesting question, Natalie. And I was thinking about that myself. Absolutely, there's a different cultural difference. Culturally in North America, we're still better about talking about menopause than in other cultures. But women do go through menopausal changes in most cultures. They just present differently. And women, and for some cultures, they don't have necessarily that experience of hot flashes or night sweats, but they will talk about it differently. They'll feel like I have an anxious attack, or I have a, so they'll talk about different things. They won't label it as menopausal symptoms, but the symptoms are very different. Women can experience it differently, and some women in all cultures, some women will sail through menopause, and other women will have a terrible time. And we, obviously have seen the gamut. I'm biased because I see mostly the women who are having a hard time. But having said that, sitting there in Africa doing some medical work, sure enough, I would look at the person's age, and I would talk about it, and I'd ask her about her periods and all symptoms, and they would not present with typical symptoms, but they would present with things like, oh yeah, my body aches all over, I'm not sleeping well, I can't cope with my kids anymore like I used to. So I mean, I'm used to that because I hear it in this culture as well, and because I'm probing a lot, but the typical menopausal symptoms are different. But it reminded me that we're all women. It doesn't matter what culture we are all women, and we are all going to go through menopause at some stage or the other. And each person's experience is different. There are some commonalities around different cultures. There's some taboos in certain cultures. But there's also, aside from the symptoms, which can be varied in different people and different cultures, how they present, but is a very interesting perspective around place in society and what it means to be an older woman versus or a menopausal woman or an older woman in one culture versus another. So in some cultures, like even in the African culture or in other cultures, women as they age, they're actually revered as wise, and there's elders in the community, and people go to them for advice, and they're part of a community that really holds people together. And so, that older person is not necessarily looked down upon, whereas sometimes in the North American culture, aging is just has a negative connotation in many ways. So I've had patients who say, oh my God, I'm going through menopause. It just, the thought of I know I'm getting older and it just really bothers us psychologically. Whereas in other cultures, it's not looked upon in such a negative way. So I think that also plays into the journey and what we experience in that journey.
Yeah, wow, that's so interesting. I'm thinking about the opportunity for a coaching conversation to really understand who's in front of you, that person. When we say know your client, I think it
Exactly.
becomes even more important when you're dealing with something like menopause, where you really want to know from the cultural perspective, from the how are you relating to this time in your life, to the physical, to
Absolutely.
the emotional. There's so many aspects that you want to open the door to exploration for.
Absolutely. There's so many different, like again, even within the same culture, some people will say, "Oh, I'm so excited because I'm able to enter a new part of my life with freedom," and it's a sense of exhilaration, embracing the new and a different stage. And for other women, it's the end of fertility, and it's the end of, and their kids are gone, and it's an empty nest, and that's it, and it's a completely different meaning. And so, absolutely, what you said is understanding the person in front of you is to help her explore her journey, or what are her fears, what is she looking forward to or not looking forward to, and how is that impacting? Because so many times women will say, it's like, oh, I can't sleep at night because, and of course, there's menopausal symptoms, but there's also anxieties that are coming up, and what's happening for that, and why is that disturbing our sleep? And we know in menopausal transitions that it's not just the hormones, but the hormone changes and the hormone fluctuations makes you more vulnerable at times to the stresses. So if people are anxious about something where before they were worried about something, it may not have disturbed their sleep, but because the hormonal changes are there, there's a heightened cortisol response at night, and so then now that anxiety will disturb their sleep. So it's a fine interplay. So usually when women are able to understand what's going on for them and how are they going to be able to deal with that and resolve their issues or find the answers or help, then it also helps the menopausal symptoms, right? Because you're decreasing the effect on the vulnerability of the roller coaster of menopause of hormones.
Hmm. So, what has been the balance for you between coaching and expertise in your practice?
Well, I haven't formally started the coaching piece yet. I informally do it in my practice. But I know that a lot of women who are excited when I told them that I'm going to be starting a bit of a coaching piece.
Okay.
They're very excited. Because again, it allows a bit more time not to spend on symptoms and treatments, but on just the journey and under exploring that next piece. But I think I probably plan to combine the two because I think people would still need the expertise. It was very interesting for when I started the coaching training was I had to learn to take off my physician's hat or my expert's hat and put it aside and say, okay, I have to just, be able to really be present and listen, and let my own thoughts or advice or suggestion or expertise not come in the way. And I think that's so powerful, Natalie. It's so powerful because it helps us not to get in the way, helps us not to get in the way of a person's own understanding of themselves and their own journey. And I think that's what I recognize and what I've learned through coaching is that is sometimes even, well, just as important or sometimes even more important than the advice itself, right? Because then they're able to get their knowledge from within, and what they know resonates with them, and what they know makes sense to them. And I think when, when we talk about coaching, the expert is the client, right? In order to do that, one really has to believe that, and one has to be able to put that other, expertise aside to be able to do that. And I think there's a role for both. In my profession, there's a role for both, for sure. And I know women would want that expertise too, but I think giving them a platform of, what's important from a expertise perspective, but then allowing them to do that journey of what's really important for them and how are they going to use that knowledge or use that the information or treatment or whatever they're going to use. How are they going to use, on what platform are they going to be able to embrace it, and how?
Yeah, and what I often tell people, because there's a lot of people who come through our programs who have expertise in a field, and I say to them, use coaching as a way to explore what's really important to the client, and then use your expertise to advise or consult. What I mean by the coaching is create a container, half an hour, 45 minutes, where you're committing to the coach approach to discover, like let the client discover really as the expert in their own life, what the focus is, what the importance of that is, what all the elements are, where they are now, where they want to be, what's in between, what's the resistance, the readiness for change, all of those things, to then be able to give advice that really speaks to the client, versus taking a client and making an assumption that, oh, you must be having the same symptoms that everybody else is having, and here's what you're going to do.
That's right.
And lo and behold, they're not, they're going through something else, right? So I think that's the opportunity, whether it be menopause coaching or other, expertise that people have, they can combine the coaching with the expertise in a really nice way that really speaks to the issue that the client has, and not just an assumption of what we think the issues are,
Absolutely. I mean, I can tell so many experiences where women will come in and, that we have a questionnaire and check off all the symptoms and this and that. And unless you really are paying attention and saying, so what's really going on? What's really bothering you? You can treat all those symptoms, but we'll miss the mark, right? And, I vividly remember one woman is like, she had all this checklist, she checked off all these symptoms. And this was early on, right? And so I was talking about all the symptoms and everything, and then just at the end, she said, "But what I really am here for is like, you know, I have no libido, and my relationship with my husband is really being affected, and how do I fix that?" And so, it was, gosh, if we had been able to get that at what was really going on in the beginning, the whole time would have been very different. And so absolutely, right, is understanding what is really important for that woman, and letting her come through to experience what she thinks she can do about it, what she actually needs help with, because that's the other thing, it's been time and time again, I'll have a group of women and everybody has a different knowledge base. Some women are really, they're good about reading all the stuff, and other people have no clue. So to assume a person has a lot of knowledge or less, you're making a big assumption there. So when we do with coaching, I think allows a person to explore what do they need, even as far as information or even as far as expertise is, someone will say, well, I've done a lot of reading. I've done all this. I know that this is what I need to do, but I'm not able to get there, right? And or they'll have a lot of information and say, but I just need someone to go through it with me. So it's different for each person. And absolutely, if we make the assumption that everyone's journey is the same, if we make the assumption that everybody's knowledge is the same, or their fears are the same, we've missed the boat, and we won't be able to do full justice to getting them where they need to go.
Yeah, I love what you said there, where that the woman who says, I just want somebody to go through this with me, like that support system, that partnering that I think coaching offers, is another opportunity for a coach to go along in that journey without feeling like you need to offer expertise, like the
Yeah.
client will find that and
Yeah.
will be resourceful to get that. So tell me about, well, first of all, I want to thank you. You left a beautiful review on Google for us. And I want to bring that up because you mentioned something, which was that whether you use coaching as a coach or not, the relationships that you have changed. And I wonder if you could speak a little bit to what that's been like for you. I know you mentioned your children.
Yeah, certainly, Natalie. I mean, I think coaching is so powerful. And I said, I think I don't know if I said in the review, but I often tell my family and my friends, I said, if even if I never use the coaching course or the coaching certification professionally, which I know I will, but even if I never did, it was so worth the time and money to do this. I think it enriched my life. I think it enriches everybody's life. I think we think sometimes we know how to listen, but really learning to be able to listen, not have biases, not have judgments, um, being really present with a person, creating that safe space. Those are things that, I've been trained as a physician and I do. But I found myself even taking that to the next level um, with my family, because sometimes you're able to do it with patients and with your professional lives, but to really take a step back and do that with adult children, with adult relationships, and practicing it and really listening at a different level. I think I found it just a very spiritual
Mm.
course. I think because what is spirituality is about knowing ourselves, right? And evolving to our highest self. And I think for me, it was just again another step in that journey of evolving my own spiritual self, my consciousness to rise to my highest consciousness. And I think the coaching approach allows us to do that.
Oh, I love that. And we hear that a lot, where the coach comes into the program very focused on a professional endeavor and then kind of gets taken aback by the personal development that takes place and
Mhm.
that spiritual journey, as you said, whatever spirituality means to you. I think that
Yeah,
it's about getting to know yourself, as you mentioned. So I'm
yeah.
conscious of time, and I know you're a busy lady. So I'm just curious to know, what would you say about your experience at the academy for anybody listening who's thinking, I wonder if I should be a coach, take a coach certification. What would you say to them about your experience in the community or the program?
Well, if I have to be really candid, I would say, first of all, it was an amazing journey. I loved it. I enjoyed every class. I think what I wasn't prepared for, I wasn't prepared for the time and commitment that was needed. So, I mean, I'll be honest. I think I was thinking, oh, it's not going to be too difficult. I've done a lot of this. Yeah, I've got a
Yeah.
psychological background. I have done cognitive behavioral therapy training. I do this type of work in my profession. Oh, it'll be a little bit of a cakewalk. So, but I was not prepared for the intensity, the time, the energy, because I wanted to, but it was to do a good job or to really be to justify what you're going to be able to do with it. I think you have to be prepared to have the time and commitment and set that time aside. I think that's really important. I do think that again, no regrets in taking it. I guess there's never a right time in your life. People are always busy, but it requires commitments, and so
Mm.
um, I think it's wonderful. It is a great course. Even if you just do it for yourself, you'll grow, you'll enjoy your life more, you'll enjoy your relationships more, you'll be able to have a different perspective with life. I love the resources that were provided. I think one of the things I loved, Natalie, about Canada Coach was when I was looking to look at a coaching course, I looked at many. A lot of them were out through the States.
Yeah.
And I found I wanted something that was ICF certified. There was a lot of small coaching courses that really didn't have the credentials behind it, so that was important to me, to have something credible, and evidence-based and academic. But the other thing was I was not, into the sales pitch stuff that I was hearing from the States. Is that really, the coaching practice? Okay, it's all about trying to promote yourself and sell yourself, and there's a big raw stuff that was happening from a lot of ones I was looking at through the States. And so I don't know, something really resonated with me when I was looking at Canada Coach Academy, when I was looking at the intention behind it, and I was looking at your qualifications and your passion and what you want to do with this coaching. When I was talking to the I forget her name, Susan at Canada Coach, and I just felt like this it resonated really well with me. It was not about, yes, we're all, for most people it's a profession and you have to do what you need to do, but there was a higher purpose there. That was really that feeling that this is about really making a difference. And I think that was really resonated with me. So I love the passion, I love the journey, and I love that realness about Canada Coach Academy, which was true to its word. When I went through the course, I felt the same thing.
Yeah, and I appreciate the candidness about the workload, because I think I get overzealous about the articles and the research that I want to provide, and it's true though, like there's a commitment, and it's important to be able to plan for that and make the time for it. I think you even had a class right after. You were taking another course, weren't
Yes.
you? You followed our class 4 hours straight.
I was doing this cognitive behavioral therapy training
Right,
at the same
right.
time, and I was like, what was
Yeah.
I thinking?
Right.
But you need the time, because
Yeah.
if you don't do all of that stuff, I think you're not doing it justice. And I think you won't be able to do the work well. It won't be as satisfying for you, and it won't be impactful for the client, because as much as the theory as well, you need the time to practice, which again, I haven't been able to do that coaching piece as much as I wanted to, because I've been so busy just with other stuff in my profession. But really looking at embracing all the workshops, the articles, the exercises that we have to do, assignments. I think it's all part and parcel, and it's so important. I would not say take it away. I would just say people need to be
Time
prepared.
for it. Yeah. Well, thank you again. It was such a pleasure to have this time with you, and really appreciate it. And it was
You're
really
welcome.
informative. I think that this is exactly what the kind of conversation that's needed. And I think you'll be really helping a lot of people to develop an understanding of what's possible in terms of being a menopause coach. So thank you for that.
Oh, you're most welcome. And we need a lot more people empowering each other. So I think it's a great journey.
Absolutely.